Hi, Wendy.
Hi, Dr. Potter. How are you?
Good. How are you?
Oh, good. Good to
Good.
see you.
You too. Thanks for having me.
Oh, I'm so excited about today. And I know that there's some people that are probably going to be joining us. I did ask some people to pre-register. So
Awesome.
so if some of you are joining us now and had challenges pre-registering, but wanted to pre-register, just shoot me a text, let me know, send me an email or leave a comment, and I'll get you your free gift because I know that I was giving a free gift away to people that were pre-registering for the event. So,
Oh, exciting.
yeah. So I'm Wendy with Mama Lottie's Online. I've been helping women for over 15 years with quick, safe fitness, and I have an online streaming service for moms with yoga and Pilates. And I love getting new resources to new moms and moms to be. It's such a special time for women in their life. And today we're with Dr. Potter, who's a naturopath in Portland, Oregon. And I'm, like I said, I'm so excited that you're here. I love the work that you do. And I just want to jump right in and have you, tell us a little bit about you and how you came to do the work that you do.
Great. Thank you, Wendy. It's wonderful to be here. Yeah, so I am based here in Portland and I am a mom to two kids. They are 2 and 4. And so it's busy around my house. And yeah, so in my practice, you know how so many new moms have trouble with mood swings, anxiety, and struggling with healing physically after birth. And they're frustrated with feeling overwhelmed with all the pressures of being a mother, and the relationship with their partner is strained. Well, I help them have a balanced mood and feel empowered with their health so they don't feel alone. And then they can focus more on this magical time of spending time with their babies. So that's what I do here in my office, in my practice. And, it was really the birth of my first baby that got me passionate about supporting moms because, in my own pregnancy, I thought postpartum healing would be easy because no one had told me differently. Right. And it unfortunately was the exact opposite. I was completely blown away.
Yes.
Oh my goodness, by how my body felt, all of the mental ups and downs. Like, I remember this one day in particular where it was a few weeks after birth, and I was in bed because that's basically the only place I could be. I couldn't even walk up and down stairs. Ugh. And my husband comes in and he picks up our baby boy, and they just had this really beautiful moment together. And I was watching that and very happy that they were sharing that. But then also in my mind, I was thinking oh my gosh, I just went through this whole birth process. I'm struggling with all this healing in my body. Why can't me as the mother, why can't I enjoy these really sweet moments with my baby? At that moment, all I could focus on was how can I get more sleep and how can I get my body out of pain? And it was hard. And I was having these thoughts well, is my body doing something wrong? Am I do something, is something wrong with me? Why do I feel so alone in this? Why does it look like everyone else is having this wonderful time in motherhood, and yet I feel like this? And so that was a really pivotal moment for me because I knew, number one, that there's no way that this was how it was supposed to be. We've been birthing babies since the beginning of time. So I knew that there was a different way to support myself and other mothers. And so, I knew in that moment, I focused on, okay, I am going to figure out how to support my body to heal and feel really strong in this time. And I remember thinking this so distinctly that This is also my path as a naturopathic doctor to help other mothers who are feeling like I'm feeling.
Right.
And yeah, and so I did that. I worked really hard to heal my own body. I tapped into my own wellness team. And it was about a year that when I felt really pretty good postpartum, which was, of course, like significantly longer than I ever expected. And then by that time I had my second baby, or I was pregnant with her. And during that pregnancy, I was like determined. I was like, I'm not going to have a postpartum experience this time around like I did that time around.
Right. Oh my gosh.
Yes.
That story, Dr. Potter, really resonated with me because I had a similar experience with my first son. I saw my husband and my son, and they were engaged, and I was like, why am I not participating? Like, I felt like I wasn't participating in this whole time. It was all I could do just to, like, get the baby fed and like maybe get some sleep and change a couple diapers. And that whole like participating and enjoying and just don't even talk about thriving, right? But just like engaging with my own child was like at stake. So I can absolutely relate with that. That really, and I think you're right. I think so many women are probably having similar experiences, maybe not recognizing it or thinking that it's odd, but you knew. So with your second one, so then what happened?
Yeah, so during that pregnancy, I put together this whole postpartum healing plan for myself. And it included nutrition and teas and, all these different supports for my body. And so I put that into practice, and it was so much better. Oh my gosh, like my body felt stronger. Of course, like motherhood has like these ups and downs. And so I went through that, but I felt like number one, I had tools to be able to reach out to when, I was having some, anxiety or, the hormone ups and downs. And, but I also felt like it wasn't as like high and low. It was much more steady during that time.
Yeah, more regulated. At least it was more like little bumps instead of these big valleys.
Yeah. Yes, and then when things did come up, I knew to reach out to other providers that I knew I needed to reach out to, much earlier than I had after my first baby. So I was able to like recognize and then get things figured out pretty quickly. So
that's great. So you were really being proactive the second time around, and like you said, kind of getting all your ducks in a row as best you could anyway. But part of that was just, having your first experience and knowing you don't want another experience like that. So that's what another thing I love about your work is that that you want to help those moms that are first time around moms, right? So they don't have to go through that whole experience and have those feelings. You want to help them feel supported out the gate, right?
Yes, absolutely. And, ever since then, so I transitioned my practice and I'm working exclusively with moms. I work with them during pregnancy to help them plan for postpartum, and then also during the postpartum time. And I developed a 5-part postpartum healing protocol to help mothers, and I use that in my practice.
That's so great. So, so with with your experience and with all the moms, that you've worked with throughout the years, like what are some of the common themes that you find that these women are struggling with?
Yes. So, one of the biggest things is this like confusion, I would say, that usually leads to, some depression or anxiety. This confusion of, okay, this is what I thought it was going to be like. And then you're in it and you're realizing that it's not at all what you expected. Every woman has a different path, a different story. So for some, it's more like the mental changes, or for some, it's more like the physical body. But it's different for all of us. But when you step back, it's like, okay, I had this idea that we would be like just me and my baby snuggling together in kind of this idyllic situation. And yet now I am just feeling really terrible. And, the thing is, a lot of women may expect this kind of radical healing process pretty shortly after birth. But for so many women, it's, they're thinking, okay, well, I'm at the 3-month mark and I'm not feeling better. What's going on? Or, I'm at the 1-year postpartum mark and my body is still in pain. Why, am I doing something wrong? Or I'm 3 years out and I'm still struggling. So that's really difficult too, because we have this idea in our culture that it's just that 6-week period, like maybe 3 months, we'll stretch it out. But after that, like, you should be good to go. And that's a big challenge for moms, is to discover that it can take longer. And really, it's moms will come in to see me pretty much for one of two things. Like, one is the mental, like irritability is huge, anxiety is huge, depression, just that general like overwhelm and burnout. And then there's that physical body piece. So typically it's around the pelvis, like pelvic pain, leakage, starting to exercise. And they just realize, sometimes, you encounter this a lot. Moms are starting to exercise like in a way that felt really good pre-pregnancy and then or during pregnancy, and then now their bodies are different and it's hard for them to figure out what works best for their body to make them feel good.
Right. Yeah, absolutely. Absolutely. It's hard because yeah, we want to go back to, what we think we know, or to your point of, we start to compare and think, oh, well, my neighbor or my sister or my friend, they all felt great 3-4 months later. And here I am 18 months out. Right. And still barely feeling it. So those are some of the myths, I guess. So what are some of the, not your treatments, but like, what's the first thing you would do, I guess, if I were to walk in and I was having some of that irritability and some, maybe some incontinence or some pelvic pain, what would be some of the tools that you would bring?
Yeah, so the first thing that we do is do some lab testing to check for hormone imbalances, nutrient deficiencies, see what's going on there. The issue is there's no standard of care for lab follow-up for moms. There's standard of care for labs during pregnancy to check on the mom and the baby, but nothing for postpartum, which is really hard because anemia, hormone imbalances are very common. And so that's something that I do right away. And then also I do pelvic floor therapy. So whether or not we start pelvic floor therapy right away, we're definitely talking about different exercises or just very simple things to start that connection with the pelvis to get the body realigned. The birth process is such a huge event.
Yes.
It's beautiful, but it's messy and your body goes through so much. So we really have to support your body to, come back into that alignment.
Mm-hmm. Do you find with women that have come in that two questions. One, do you find that most women are aware that they need to have their hormones checked before they come see you? Or is that news to a lot of women, like, oh, my hormones might be off? And I know that by the time they come and see you, they've probably done a little bit of research, or they might, be sort of at a different place. But what do you find usually?
Yeah, I would say it's probably 50-50 actually, because a lot of people are reaching out to me because, they've talked to their own provider or their primary care provider and they aren't getting the answers that they need. So then they're coming to me because they're specifically looking for hormone testing. But a lot of women are coming in just, saying, I don't feel good. This is what's going on. And then that's where I take that step to say, okay, like we're going to start by looking at what your hormones are doing, looking to see to find out if you have any nutrient deficiencies, because those can lead to mood swings.
Right.
When our hormones are going up and down, that can lead directly to mood swings. Or, if a mom is anemic, which is very common after going through the birth process, that can lead to anxiety. So we have to do some investigating to figure out what the root cause of what this mom is struggling with.
And absolutely. And then do you find, and this might not, do you find that there's sort of a common theme, like most women after they've had a long labor and a birth, if there's a hormonal imbalance, it's usually like cortisol and thyroid, or do you find it's just sort of all over the map, just depending on the mom and what's going on?
Yeah, it's going to depend. Cortisol is one of the hormones that I'll test first because that's our stress hormone. And because of all of the stress that we've gone through and that we're going through with sleep deprivation, and just managing this transition into motherhood. So that's typically the first hormone that I'll test for. And that is very helpful to find out, if it's a cause for mood swings or insomnia, things like that. I will test thyroid as well. About 5 to 10% of women will have postpartum thyroiditis in the first year postpartum. And that's even a low number because, again, there's no standard of care for testing. So if all of these women are not getting tested for the thyroid, then we don't actually know what percentage of women are having this thyroiditis. Because, again, the thyroiditis symptoms are very similar to what just moms are experiencing in general, like fatigue, inability to lose weight, insomnia, mood swings. Right. And a lot of moms, because we live in this culture that's not really honoring this postpartum healing period, we just think like, oh, well, that, I'm exhausted, but that's the price of motherhood, or, so women aren't seeking that out. But it's really important to connect with somebody who can be your guide to help you navigate this time as you are healing from the birth process.
Oh, yeah, absolutely. Mm-hmm. And sometimes if you're so depleted, it can be hard to take that step to get the support that you need, right? Because you don't even know where to turn or can't even execute a plan. Mm-hmm. So how would moms know if it's like, is it just sleep deprivation and sort of that fourth trimester and just kind of recalibrating the hormones, or, is it something more? Like when would you suggest, I suggest all moms get a hormonal saliva or blood test postpartum. Yeah. But like when would you suggest that a mom actually kind of seek that out when it's not just, sleep deprivation?
Yes, right. There are plenty of women who do transition well after giving birth, and they have those pretty minor ups and downs, but overall it's okay. But for moms who are just feeling like something is not right, you definitely want to reach out to somebody to help you navigate this time. If you are planning to go back to work, then it's really important to touch base with somebody who can help you in this postpartum time, because you want to make sure that you are, nourished and replenished and are balanced before going back to work. But really, it's when you feel like something's off with your body, that's time to seek help. Because number one, if you talk to somebody and they are, a healthcare practitioner, like you go in to see your provider and they are telling you something like, well, the symptoms that you're experiencing are just because you recently went through birth. That's actually a red flag that you need to go seek out somebody who is willing to do that extra work to help you. And then also knowing that even if you are that, 8 months postpartum, 18 months postpartum, and you're still feeling like, your body just hasn't come back like you expected, or, isn't feeling strong, you're still having lots of anxiety and irritability, like that's still a time to reach out to get help. Even if you feel like, well, but I'm so far post birth, is there anything that can help me? Like, yes, absolutely.
Yeah. And that's great, because I think those are some red flags for sure. Like you said, working with a provider that just says, oh, it's just it's just normal, or give me a call in 4 months and see where you're at. That's an eternity, of course. When you're going through that.
Yeah.
And then so some of the signs, like you were saying, sort of that like heightened anxiety, heightened irritability, coupled with the fatigue. Yeah, can definitely be a red flag, for sure. So the other question I have, I'm just bombarding you with questions because I love this topic. It's so dear to my heart. But do you find that women, and absolutely some women, they have an easier time than others, right? In terms of that postpartum time, in terms of pregnancy, in terms of motherhood. I mean, my personal philosophy is you sort of have to pay the price somewhere, right? You might have this like really easy peasy pregnancy, but then your labor is really intense. Or you might have this really, easy peasy pregnancy and labor, but then that postpartum period, or have a great pregnancy, postpartum, everything. And then you've got, this 6-year-old that is, spirited or whatever, right? You got, there's no free ride with motherhood or parenting. We know that. But what, so if someone comes in and sees you and then they do you do a saliva test or a blood test, how long does it usually take for them to get the results? And then you put together a plan with them. And then how long does it take for them to actually start feeling a little bit better?
Yeah, great question. So the test can be done right at your home. Like particularly if we're doing cortisol testing, that's a salivary test. So it's a test kit that's mailed directly to your house. Very easy to complete and then send in. We can even do other labs at home. Like there's little blood spot testing. We can do testing of hormones through saliva as well. So if particularly right now, you're hesitant about going into a lab to get blood drawn, there's still ways to get labs done in the comfort of your home in a really simple way. So if we were to go that route, then results come back typically within like 5 days. And then you and I have a appointment to go over those results and get your action plan together. And then, like I see people feeling steadier, like within a couple weeks, really, once we get things going. Typically I'll see people a month post when we started the treatment plan. And by that month time, they are seeing some really good results. One patient in particular I'm thinking of, she came in, she was talking about anxiety, insomnia, and leakage. And she was about 8 months postpartum when we started working together. And so we did this exact thing. We did salivary testing. We did some other tests. And then when she came back in that next month after she had started her treatment plan, she was just saying like, okay, like I'm sleeping better. I'm able to respond better during the day. And I'm actually like waking up and I'm saying like, okay, what kind of fun adventures can me and my baby have, instead of
that's
like
huge. That's a success story. That's fabulous.
Yes. Yeah.
Awesome.
So, and then we have to work on strengthening your body to get that leakage taken care of and stuff. But it's just really wonderful to hear those stories. Yeah. Right as we get working together.
Oh yeah. I mean, why, for moms, I mean, it's like, why drag it out for years, I mean, some moms, it's like the whole rest of their life, their hormones are off if they never really get them under control,
Mm-hmm.
The other question I just remembered I wanted to ask you was, do you notice with the hormonal imbalances that it's sort of more extreme depending on what type of labor or what type of labor a woman had and or her age? Like for older women that are more like advanced maternal age, as they get closer to sort of that perimenopause phase, but there's, you know, having babies. Have you noticed at all, like, that it's harder for them to kind of recalibrate their hormones than it is to a younger mom, or not? I don't know. Just was thinking that.
Yeah. Yeah. So first with depending on the labor, I find it less on what happened during the labor, like from my point of view. It's really, you know, kind of what happened during the labor and what kind of stress that put on the mother, if that makes sense. Like,
Yeah.
let's talk about tears during the birth process. So if a woman has like a second degree tear, some women actually can bounce back pretty quickly from that. And she's like, okay, you know, I just had this little tear and I feel pretty good. But for another woman, that can be like really debilitating to her, and the way that her body is healing in that process is actually much harder, much longer, more pain for her. And, you know, maybe that has to do with extra stressors that are happening or something different that happened in the labor. So it's, you know, it's like women can have a similar birth experience or similar labor when it comes down to, you know, how was the baby delivered? How many hours were they in labor? Things like that. But then how women are responding to is different. So
Yeah, that makes sense.
answers that question. Yeah.
Yeah.
Is that and then yes, as far as like women who are having babies older and who might even be like starting to get into that premenopause period is yeah, you know, that's when we really want to be jumping on the hormones and making sure that those are balanced, because you know your body is going through the hormonal swings of the birth process and this postpartum time, and then as you're getting closer to menopause. So we really want to make sure that your body is balanced and strong, and yeah, having those hormones balanced. And you know, just a thought that came up in my head as we're talking about this is, a lot of times, you know, when we're talking about hormone balance, women will think like, okay, we're talking about like progesterone and estrogen and having to do with the menstrual cycle and all that, which of course it is. And I help women with balancing their periods all the time, because usually it's different postpartum than it was pre-pregnancy. But also, you know, the thyroid hormones are so important. Looking at cortisol, our stress hormone, and, you know, remembering that our endocrine system, our hormone system, is a whole system in the body, and all of our hormones are talking to each other at once. That's what hormones do in the body, is they're communicators. And so it's important to also work with somebody who will look at your hormones in a holistic way. Not just looking at, say, your progesterone and estrogen if you're in that like premenopause time.
Right. Oh, that totally makes sense. In terms of the cortisol, especially, and so if a woman's going in to get some type of a panel done or having some type of a saliva test done, they should advocate, because an allopathic doctor might say, yeah, let's just run a lab on your progesterone and test progesterone and estrogen, right? You're saying it really should be much more thorough. So women should sort of advocate for that if they're talking to their allopathic doctor and say, hey, let's run a whole panel.
Yes.
Okay. So, and then you talked a little bit too about just nutrients, right? Like nutrients that moms could have on board either during pregnancy or sort of leading up to the delivery, or even postpartum, you know, immediately postpartum. Are there specific nutrients that you recommend to women during that time to help kind of prevent this hormonal imbalance or ease it a little bit?
That's so I go about it in a couple different ways. So first, after birth, you really want to check to see if you have like anemia or your ferritin is low. That's a form of iron. Because we lose so many fluids during the birth process, it's important to check for that to see if if you need to be replenished with iron, B12 as well, folate. Those can all lead to anemia. And so you can actually get tests done to look for those. But then also there's this, how I work with women, because I'm also a nutritionist. I was a nutritionist before I became a doctor. So I work a lot with nutrition. And, for a lot of women, because in our like conventional care of a mother, there are no ideas about what foods mom should be eating. I mean, if you look at a pregnancy nutrition section in the bookstore, like there's so many books. And then if you look for postpartum nutrition, like there's very few. And, we have this idea that moms need to be, oh, they're fine. Like the healing process isn't hard. Like you can go back to eating in a way, that to try to lose weight to make sure you're in your pre-pregnancy pants, or, there's no real reason to add any different foods, which that just leads for so many women to that depletion, exhaustion, feeling overwhelmed. There are just really beautiful, nourishing foods for the postpartum body. If you look around at cultures around the world, what cultures have been doing for thousands of years, like food has been a very important part of the postpartum healing process. And so like broth in particular is really important. And like a good bone broth is wonderful because it has that collagen in it, and that's helping to strengthen the postpartum body. So that in particular, but there are other foods that are very specific to helping the postpartum body heal in this time after birth.
Yeah, the broth is huge. And I know I remember reading something about carrot soup specifically. I don't know if there's some, vitamins in that, but yeah, that can be so helpful just to get that good food on board, and to have it right at the ready, so that that after that baby comes, you might not be able to make your, bone broth that needs to, be on the stove for 2 days or something like that. So make it before and freeze it and have it, and that can help. I was looking to see at my other questions that I had for you. Some of them, I guess I got. What? So in terms of the nutrition after birth, having a hormonal panel done. Is there anything else that you can think of that can help during that after labor sort of that fourth trimester time that can really help with balancing hormones? I mean, any other type of a modality or treatment, that you recommend to moms, especially moms that might really be struggling, sort of have a little bit more of the extreme depletion, or like we were saying, the high highs and the low lows?
Yeah, I mean, there's so many different things to support a woman in this period after birth to help you feel more grounded. So, yes, I mean, there's such a long list. First off, finding a guide, someone to help you navigate this time, to see what's specific for your body, what are the root causes of whatever it is that you're going through. So you definitely need that. I, being a naturopathic doctor, I use herbs, I use natural supplements that I find have excellent benefits for women and the moms that I work with. And then nutrition, other modalities like acupuncture, chiropractic work, massage. There's so many things to help you. So yeah, for any mother who is exhausted and struggling right now and watching this video, I want you to know that there is hope out there. This is what I do. I do help my patients navigate this time and test for hormones, test for any deficiencies, and help you, feel strong and empowered. So if you're in that place and you need somebody, I have some special spots reserved on my calendar for you. So go and head to my website, drangelapotter.com, and just tell me that you came for this interview, because my schedule is filling up. We're, moving into cold and flu season in the middle of this pandemic. Like, people are looking for help. So, but I have reserved some times for you. So please reach out if you need that help.
Oh, that's wonderful. So you're doing the telehealth, so people could schedule an appointment with you anywhere, basically, right? And do it all online, and then you would prescribe a test that would come to their house that they could do, and then you'd have a follow-up consult with them online. So it's all could be done online, basically, telehealth.
It's so easy. You can be in your pajamas, and we can be helping you feel fantastic.
Yeah. Well, and I think like we talked about before when we did our interview a few weeks ago, there's so many stumbling blocks for those moms postpartum, right? If you have to get out the door with your baby, to drive and then to park and then to go see your doctor and to get that help, there's so many chances it's just not going to happen. And I know COVID is less than ideal, absolutely, but at least there's this opportunity now for moms to, like you said, be in their pajamas, be home with the children, be doing whatever, and get the connection and the help that they need. So what else do you want to tell us about what you do or what you're offering? I want to make sure we cover everything because we had some good questions.
Yes. I think that's it, to know that, your body is not doing anything wrong, and that there are these tests that you can get, because, the feedback that I get back from my patients is that once they have these lab tests, it's like a blueprint, right? Where they can say to their partner, like, hey, look, like there's something going on with my body and I need some extra support. Or, they can talk to their friends or their parents, to get this extra support. And it's just a really good way to validate, like, okay, yes, like my body does need these extra things right now. And, it's hard. It's really hard as a mom to 2 kids. I completely understand. And there are ways to help you feel more balanced and strong in your body.
Yeah, absolutely. And I mean, that's the thing, at least, I know these modalities and herbs have been around for, hundreds and thousands of years, but I do feel like just in the last sort of 20 years or so, it's become more mainstream and a little bit easily accessible, for new moms to get what they need. I had a question about hormones. If someone did come to you, you decided on the treatment plan was going to be some type of a hormone therapy, and a mom wants to get pregnant, maybe a year later, how does that work with either weaning off the hormones, or how do you navigate that?
Oh, yeah. I mean, it depends on the situation, but typically, so if we're looking at either cortisol or stress hormone, thyroid hormone, or that reproductive, like progesterone, estrogen, all of those are really important in the fertility journey and becoming pregnant. And so I want to make sure, those are going to be helpful in that journey. And then usually it's like once she has a positive pregnancy test, that's when we talk about, okay, well, what do we need to take off because pregnancy, or what needs to stay on to be supportive of the pregnancy. And then of course, not all natural supplements are safe for pregnancy, which is why I'm saying, we need to take some things off. But typically, I am really helping with hormone balance if that woman is wanting to get pregnant. We want to make sure she's got a really robust plan in place to help her be balanced with her hormones as she looks forward to pregnancy.
Yeah, absolutely. And then I'm sure with the hormones, it probably takes a little bit of tweaking to get like the levels exactly where you want them. So you might come out with an initial plan that would start with like a small dosage, and then maybe you would, I mean, again, depending on the mom and the circumstances, and then you might add, as you check in with the mom, see how she's feeling, you might, modify the plan. Is that right?
Oh, absolutely.
Yeah.
Yep. We stay in touch and do follow-ups so that we make sure that, everything is smooth and balanced, and talking about what's come up for them. And then, okay, so this came up for you this month. Like, how do we move forward to help, smooth that out as well?
Oh, that's so great. So like you said, you're like one of those team members that you wanted for your, second birth. It's like, from your experience, right, exactly what these moms need, right? And how to deliver it in a way that can be accessible. So I think, don't you have a course or something too that moms can do? Or what else do you have? I know you have your consultations, but tell us what else you have, and also where people can find you.
Oh, thanks. Yeah. So yes, I do have an online course, and I have one to help women in this postpartum healing process, to talk about nutrition and hormones, and then also one to help balance periods and to learn about menstrual cycle awareness. And then I also do my one-on-one appointments, and you can find out more at my website, drangelapotter.com. And again, if you are in need of somebody to help you, a guide, someone to help navigate, I am here to help you. And so you and I can just jump on the phone for a quick free consult and talk about what's most frustrating to you, and then get a plan in place to help you feel strong and balanced. So just head over to my website and tell me that you came from this interview, and I'll get you on the calendar.
That's awesome. That's so great. And I'm excited because we're going to have this interview available. I'll have it on my Mama Lottie's online YouTube site. And then in the comments, I'll have links to your practice as well, and to Dr. Potter. So that'll be there if you have friends you want to send over there, or again, if you want to, make an appointment with Dr. Potter now or in the future, that'd be a great place too. Or just go to drpotter.com and right? Is that what you said? drpotter.com?
Dr. Angela Potter.
Dr. Angela Potter. Okay. Yeah. And because I just think this is you offer such a gift, to these moms, and it's such a hard time, like we talked about. So many moms are struggling, especially now, and we do start to think in our mind like, oh, it's just the sleep, or oh, it's just because the little baby's waking me up, or I'm stressed because finances, or what, going back to work, whatever it is. And I just highly recommend, for all moms to get in touch with you and get their hormone levels checked, because you have no idea what's going on. It's such a complicated system in there. So I'm so glad we had this talk today. It was really informative.
Oh, thank you, Wendy.
Thank you, Dr. Potter. Thank you for all the work you do and for being available for us. I really appreciate it.
Oh, you're welcome. I'm happy to be here.
All right. Have a great day. Thank you.
Oh, thanks. You too. Bye, Wendy.
Okay. Bye.